Hello, today I'm gonna show you how I take an impression, a two-step impression technique. I'm gonna use a material from Lascod for this. It's called KromopanSil and it comes in two consistencies, a putty and light flow material. This is an Italian brand. I'm using this every day. I find it has a really good quality per price ratio. I'm using other materials as well, but this is one of them. So I want to show you the kind of impressions this material produces, and I'm gonna show you with different materials as well in other videos, so you can have an idea on each material how good of an impression it makes. This is not a sponsored review, this is my own material. I do use it in my own office. I use it daily. So what do we need for this? We need the putty material, we need the light flow or light body material, we need a tip for the light body material, and a precision tip for dosing light flow material around the preparation. We also have a putty knife here for carving release canals in the putty material. I'm going to show you in a bit, and a sterile impression set of trays. So also an impression gun. It's a 1:1 ratio, so it's for material that have these two sections equal. There are also 1:2 ratio, 1:4 ratio, and even higher than that. I'm not gonna use a prepared tooth for this. We're gonna pretend like one of the premolars or one of the molars is prepared for a crown, and build those material release canals based on that. So first of all, we need the trays that are appropriate to the size of our model in this case, but based on the patient, you're going to choose the appropriate trays for each situation. So let's see if this is okay. I would say it's okay. So let's prepare the putty material. It comes in two cartridges with 2 spoons, each one coded for the respective color. Don't mix them up You have the purple spoon for the purple color, the white spoon for the white color. In the case of this material, it's a fast set variant. It sets in 1 minute and 30 seconds. Try to dispense equal amounts of material. If you're not sure if the material is going to be enough, just organize it in a roll, and this should get to the half of the impression tray. In my case, I think I'm gonna need a bit more. Try to approximate as best as you can. I make them flat like this because I think they mix better. Lay them flat on top, one on top of the other, and then I start to mix them up. What we're looking here is an uniform color, as uniform as it can be. So you kind of need to do this fast before the material sets. Create a roll, place it in the impression tray. Okay, and place it in the patient's mouth. While we wait for it to set, we can prepare the light body material. Always dispense a bit of material before that's enough. That's because the material usually has some oils in it, and you need to make sure these don't mix with the other part of the material. Maybe I'm gonna cut or edit some of the dead times here. I usually don't edit my videos because I want to make them as accurate as possible to the real office scenario, so you can have an idea exactly on the times it takes to do the procedure. Starting to set. Of course, intraorally it will set a hell of a lot faster than this because of the temperature difference and sometimes because of the presence of the saliva. Some materials are specially created to fast to set in at a certain temperature or humidity, emulating the time spent in the oral cavity. So what we're going to do next is we're going to carve some escape canals for the light body material. You are going to carve this from the tooth to a central section in the impression. You can use a putty knife like this, or you can use surgical blade. The only tooth or the only teeth where you're not gonna carve these escape canals are the prepared teeth. Except those you're gonna carve so let's see. Okay, so this is the putty of KromopanSil. So now the putty knife. Okay, so let's say this is the prepared tooth. So we're not gonna create escape canals from this tooth. We're gonna create from all of the rest. So what you're gonna do is with a bit of force, you get the whole idea. Make sure you remove all these cuts from inside the impression. So now we have cuts done to every tooth except for the preparation. We don't need escape canals around that tooth. Okay, so now we're gonna test the impression again, make sure it fits easily. In our case it fits. Okay, so it's time for the light body material. So what I do, I actually put the light body in the putty, and afterwards I place a precision tip on it and put some light body material around the tooth with the preparation, and place the impression on the teeth and wait for it to set. When dispensing the light body material, make sure the tip is always below the level of the squirted impression material, so you don't create air bubbles. Okay, so let's see. I cover the whole preparation with impression material with the precision tip. And a bit on the neighboring teeth. And then I place the impression tray on the teeth and add some pressure to it. Remember, you have those escape canals for the material, so you won't have deformation of the soft tissues. Some doctors dispense a bit of material on the operating table, so you can know when the material sets. In the case of this material, being a fast set material, it sets pretty quickly. I would say in about 2 minutes intraorally. We're going to do the same technique with materials from Kulzar in a future video. It's called Vario Time because you can vary the setting time. of the material. Starting to set. You do the same procedure on the opposite side. Escape, except the fact that you're going to create escape channels for the light body on all teeth. If you don't have prepared teeth, of course. If just this is the only preparation, you're going to have to make escape canals for the light body on all the teeth on the opposite side. If you also have preparations on the opposite side, you just don't make the release canals on those teeth, and you make on all the other. The procedure is the same. First the putty, you create the escape canals for the light body, you place the light body material in the putty, and you reinsert the impression tray and wait for it to set. You're going to have some difficulty removing the especially this being a study model, some of the material will enter between those teeth and make it difficult to remove the impression tray, as you can see. It tears a bit because of this. This won't happen in the mouth, as you can see. As you can see, our light body material escaped from those those canals, and if it weren't for it to go between the teeth and tear, we would have a very beautiful impression. Thank you for watching, and let me know if you have any questions or comments regarding this material or impression technique. If you like this video, please hit the like button and subscribe to my channel. It helps a lot. I'll see you in the next one.